So, your doctor hands you a prescription, and it feels like the start of a solution, right? But what about the rest of the story? The part we almost never talk about. What happens after you start taking it? And, crucially, what happens when it's time to stop? Let's get into it. Okay, so you've been prescribed something new. You're probably feeling hopeful, thinking this is going to help you feel better. But that's just the beginning of the journey. The real question, the one we're really digging into today, is what happens at the end of that road? How do you safely and successfully stop?
All right, let me just throw a number at you. 20%.
So what's that 20%? Well, that's how many people get withdrawal symptoms when they stop an antidepressant cold turkey. We're talking 1 in 5 people. This isn't some super rare thing, you know? It's a very real, physical reaction, and it really drives home why we need to understand the full story of these meds.
But, before we even get to the whole stopping the medication part, we need to talk about some risks that can pop up while you're taking it, even if you're doing everything right, exactly as prescribed. And sometimes these are connections that aren't super obvious, linking different parts of your health together in surprising ways.
So check this out. It's kind of wild, right? The link between medications for your head and the health of your heart. I mean, think about it. Common ADHD meds, even some antidepressants can actually nudge your blood pressure up. And then you've got certain antipsychotics that can mess with your heart's rhythm.
And this is where things get really clinical, but in a good way. It shows you that managing these risks is a really careful process. Doctors have these flowcharts, these protocols to screen patients, look at their family history, and just keep an eye on things. It's a huge reminder that talking openly with your doctor, it's just absolutely crucial. Okay, so it's not just about the pill itself. The risks can also come from how that pill interacts with, well, with everything else. We're talking other drugs, sure, but also daily habits you wouldn't even think twice about. I mean, take smoking. Perfect example. You'd probably think it's a totally separate thing from your medication, right? But believe it or not, the two can be linked in a way that can seriously mess with your treatment. So here's the deal. The chemicals in tobacco smoke basically tell your liver enzymes to go into hyperdrive. And when that happens, your body starts breaking down certain medications, like some common antidepressants and antipsychotics, way, way faster than it's supposed to. The result? The actual amount of the drug in your system can plummet, sometimes by as much as 50%. That means you might not be getting the therapeutic dose you actually need. So what's the fix? Well, the good news is it's actually pretty simple. You just have to tell your doctor if you smoke, or even if you've just quit. That way, they can adjust your dose. It's a simple chat that can make a massive difference. All right, let's switch gears to something a little more complex. Check this out. Some medications, like the heart drug clopidogrel, are what you call prodrugs. Kind of sounds cool, right? It just means they're not active when you swallow them. Your body has to use its own enzymes to flip a switch and turn them on so they can do their job. And this is where it gets tricky. It turns out that some antidepressants can block that exact same on switch. So your mental health medication could, totally by accident, be making your heart medication way less effective. It's just a perfect example of why your whole medical team needs to know everything you're taking. Okay, so all of this brings us to what is often the hardest part of the whole journey, actually stopping the medication. For a lot of people, it's not as simple as just not taking a pill one day. It can be a really confusing and honestly pretty distressing experience.
So, first things first, let's define our terms here. We're talking about something called antidepressant discontinuation syndrome. And this is key. It is a physical response your body has because the medication is gone. It is not, I repeat, not a sign that your depression or anxiety is coming back. It's a physiological reaction.
The symptoms themselves can feel all over the place, kind of vague. But there's this great mnemonic, finish, that really helps pin them down. We're talking F for flu-like symptoms, I for insomnia, N for nausea, I for imbalance or dizziness, S for weird sensory stuff like brain zaps, and H for hyperarousal, feeling super anxious or irritable. Just being able to put a name to these things can be so validating. Okay, so the big question is, how do you know if it's discontinuation syndrome or relapse? It's a huge point of confusion. Well, discontinuation symptoms usually show up fast, within a few days, and they often feel really physical. And the telltale sign is they often go away pretty quickly if you restart the drug. A relapse, on the other hand, usually creeps in slowly, over weeks, and it's mostly emotional symptoms. Getting this distinction right is just so important for getting the right kind of support. Now, as tough as antidepressant discontinuation can be, the stakes get even higher when we talk about another class of drugs, benzodiazepines, things often prescribed for anxiety or sleep. With these, stopping too quickly isn't just unpleasant, it can be genuinely dangerous.
And really, nothing drives this home more than hearing from someone who's actually been through it. This quote is from a patient named Dawn. Just listen to this. Her experience, being taken off a tiny dose too fast, it just shows you the profound, life-changing difference between a safe, slow taper and a dangerous, fast one. Now look, the point of hearing all this isn't to scare anyone. Not at all. It's about building awareness, because knowledge really is power. So this last part is all about how you can take this knowledge and become a true partner in your own healthcare to feel empowered. So what does a safe discontinuation plan actually look like in practice? Well, rule number 1, never ever go it alone. Always work with your doctor. The absolute key is a slow, gradual taper. In fact, some of the newest guidelines are suggesting a reduction rate as low as 5 to 10% at a time. And the whole time, you have to remember that these symptoms are temporary, they're reversible. The goal is just to manage the process smoothly. You see, every medication has a whole story, a beginning, a middle, and an end. And understanding that full story is how you navigate your health journey safely and confidently. So the next time you're talking about a prescription, maybe the real question to ask is, what's the full story of this medication?